Hi, I'm Dr. Matthew Widner. I'm an orthopedic sports medicine and joint replacement specialist here at Orthopedic Center of South Florida. Today, I'd like to talk to you about shoulder arthritis and shoulder replacements. So the shoulder is a ball and cup socket. The ball is made up of the humerus, which comes up, sits in the glenoid, which is made off of the shoulder blade. So I have a model here that kind of helps explain it a little bit better. So the humerus comes up and makes the ball here, and then the shoulder blade comes over and makes the cup that the ball sits in. You can kind of think of it as a golf ball and a tee, and there's a lot of range of motion in the shoulder. Supporting the shoulder, surrounding it is a lot of ligaments and tendons and things like that. The ones that we typically focus on are the rotator cuff and the biceps. So the biceps muscle sits down here on the arm, comes up, forms a tendon, and the tendon comes all the way in and attaches at the very top of the cup part of the shoulder joint. And then the rotator cuff, you hear a lot about the rotator cuff. What it really is a collection of four muscles. The muscles, similar to the biceps, how the muscles are down here and then tendons in the shoulder. Same thing with the rotator cuff. So you have all of the muscles that sit over here around the shoulder blade, and then they come over, they form tendons, and then the tendons attach to the bone. So you have one in the front, you have one in the top, and then you have two in the back. The one that's most commonly torn is the one in the top, called the supraspinatus. You also hear about the subscapularis, which is in the front. Many different types of arthritis. The most common type is just osteoarthritis. That's your standard, wear and tear, general use over time. The other type of arthritis that you'll hear very commonly as well, that we'll also go over, is something that's associated with chronic rotator cuff tears. It's called rotator cuff arthropathy. And that happens when someone has a really big rotator cuff tear that either went unnoticed, which is not uncommon because rotator cuff tears are a degenerative process, or sometimes they are noticed and they undergo a repair. And then maybe over time, the repair breaks down and the rotator cuff tears again. Or maybe you and your surgeon selected to go with non-operative treatment, which also is not uncommon. Rotator cuff arthropathy is a very special type of arthritis that, again, we'll go over when we talk about the different types of shoulder replacements. Shoulder arthritis is, like I said, a degenerative process, something that typically is treated with non-surgical treatment until the pain becomes significant and you need the shoulder replacement. So the non-surgical treatments are activity modifications, avoiding the things that cause the pain, particularly lifting heavy objects in the air, lifting heavy things away from your body. Another common symptom that I see a lot is pain at night and wakes you from sleep. Patients with shoulder arthritis, particularly once the shoulder arthritis becomes severe, have a very difficult time sleeping. There's activity modification, there's anti-inflammatory medications as long as it's medically safe to do so. These medications include ibuprofen, Advil, Aleve, Celebrex, meloxicam, things like that. And then there's physical therapy, which when you have shoulder arthritis, typically you lose range of motion. The muscles around the shoulder start to get a little bit weak. So certainly physical therapy is very, very beneficial for shoulder arthritis. If none of those things really resolve your symptoms, you can start thinking about injections. There's multiple different types of injections. We do multiple types of injections here. Usually we start with a cortisone injection, which is a steroid. That's something that's injected into the shoulder and reduces the inflammation, which reduces the pain. All injections are considered temporary because none of the injections actually repair or fix the arthritis. Once you have arthritis, there's really nothing we can do to reverse the arthritis. The initial treatment is symptomatic treatment, helping with your pain, helping with your function. And the only real fix for arthritis would be a shoulder replacement. The other types of injections you can consider are things like platelet-rich plasma or in short PRP, or viscose supplementation, which is not necessarily done very often for the shoulder. That's typically done more for the knee, but it is an option for the shoulder as well. Patients often ask me, when is it the right time to do a shoulder replacement? I have 3 criteria that help patients decide when they're ready for the shoulder replacement. The first criteria is that you've exhausted all the non-surgical treatments. So everything we just discussed, the activity modification, anti-inflammatories, things like that. The second criteria is that your symptoms are interfering with your activities of daily life and the things that you need and want to do. We have a large patient population that plays pickleball. A common issue with patients is that they can't play pickleball anymore because their shoulder is bothering them too much. The third criteria would be that you are having essentially more bad days than good days when it comes to the pain. So if you meet all 3 of those criteria and you're ready to proceed with the shoulder replacement, that's usually when we decide to proceed with the shoulder replacement. There's 2 main types of shoulder replacements that you can do. One is called an anatomic shoulder replacement. That's essentially just removing the arthritis and replacing it with metal and plastic. That is done essentially for regular osteoarthritis. That's that degenerative wear and tear thing that happens over time. The shoulder is the ball and cup joint. So with an anatomic shoulder replacement, you go in surgically and you remove the ball, and then you kind of level out the cup, and then you replace the ball with a piece of metal, and then you replace the cup with a piece of plastic. So looking more at the humerus, like I said, you remove the ball part, and then you prepare the inside part of the bone. And there's multiple different ways that you can put a new piece of metal in its place. What we've been using more frequently, especially with younger patients who have better bone quality, is something called a stemless. So this right here is considered a stem. This will typically slide inside the bone. With a stemless component, you don't have this. You essentially have this with either a cage or a screw or something that does go into the bone a little bit. The benefit of that is that it preserves a lot of this bone, which helps with pain. It helps with the recovery after surgery. And if, like I said, we're doing this a lot more in younger, 40s and 50-year-old patients. So if later in life, when they're, 70, 80 years old, if for whatever reason their shoulder wears out, like the piece of plastic, which I'll show you wears out, it saves a lot of bone. So your revision surgery in the future, you have a lot of bone to work with. So that's definitely a benefit there. You're basically leveling out the cup part of it and then putting this polyethylene is what we call it. It's a really strong piece of plastic that goes directly onto the bone. And then your new shoulder looks something like this. That's the anatomic shoulder replacement. The other broad option would be something called a reverse shoulder replacement. And the reverse has many applications. We use it for patients who have had a rotator cuff tear and developed arthritis because of it. We use it for fractures a lot. Our complex shoulder arthritis cases where there might be some bone loss, we usually use it for that as well. And the reason anatomic is called anatomic is because you're replacing the ball with a metal ball and replacing the cup with a plastic cup. With a reverse shoulder replacement, you're reversing those. So the ball now becomes the cup, and the cup now becomes a ball. So this is how the humerus looks. Again, similar process to the anatomic, where you're removing the ball part of the joint, and then instead now you're putting that metal stem in, and that metal stem now has a cup, a plastic cup. And then when you look at the cup side, you're leveling out the cup just like before, but now you're placing a metal ball on this side. And so it ends up looking like this. The reason they can't have an anatomic shoulder replacement is you're not doing anything to restore the function. When you have a chronic rotator cuff tear, your arm is not moving well because of the lack of the rotator cuff muscle. So if you put an anatomic shoulder replacement in, it might help with the pain, but it's going to do nothing for the function of the arm. You do a reverse because when you're changing the ball in the cup, you're changing the rotation of the shoulder. And that basically allows all of the other muscles around the shoulder that move the arm to be more advantaged, meaning that the position of the ball and cup is in a way that those other muscles work better. For me, when I do shoulder replacements, I do use computer templating software. It requires a CT scan of the shoulder preoperatively, and that gets uploaded to the computer system. We use special software to basically create a 3D model of the shoulder, and we use that 3D model to plan exactly what implants you're going to need. It does two things. One, it helps me plan, it helps me position appropriately. It also will create a custom guide when placing the pin into the cup part, and the whole shoulder is built around that. So it's a very important step in the process of the shoulder replacement, and the templating software really helps make that much more accurate. If you're having significant shoulder pain, you're having difficulty sleeping at night, you're having difficulty raising your arm or moving your arm or doing the things that you need and want to do, don't hesitate to contact the office to make an appointment with me, 954-473-6344, and we'll make the soonest appointment for you to come in to see me.